Well, welcome everybody to this mini summit 4 of this conference. Our focus will be growing the social care workforce for the future. Just a few words from me, and then I'm going to ask my co-chairs to say a few words too, and then we're going to move on to our contributors. Our care sector has been in crisis for many years, but for too long, in policy terms, social care has been treated as an afterthought. We can even see that today, on a day of big announcements for the NHS and apparently social care. We continue to wait for reform of funding of social care. And yesterday evening, we saw the government launch a care recruitment campaign, which started talking about volunteers and people with no experience being taken on short term. Care staff have been consistently underpaid, and undervalued, resulting in more than 110,000 vacancies across the sector, with 11% of registered care home manager posts vacant. Care staff look after our loved ones, our family members. What they do is one of the most important roles in society, but we don't currently value them as we should. And for too much time in this pandemic, care staff have actually been the forgotten front line. The care sector struggled to get enough PPE to protect staff and residents. COVID was then seeded into care homes by patient discharge from the NHS, but then there was little or no testing for care homes to manage that. And in those care homes, staff stepped up to the challenges. There were many deaths from COVID among residents, providing palliative care, working with enhanced levels of infection control. And in some cases, care home staff shut themselves away from the outside world for months to protect their residents from COVID. And I know that many home care staff also worked longer hours, tackling tasks usually done by GPs or district nurses. Now, talking to care staff after the first wave of the pandemic, they didn't feel that the public gave them the recognition as key workers that NHS staff had got. They weren't given priority slots for shopping. Staff told us they were tutted at in the street when wearing their uniforms, and they were offered a care badge as recognition, but then very few of the badges were actually delivered. I feel that without the work of the 1.3 million care staff in this country, we simply wouldn't have been able to cope with the crisis on the scale of this pandemic. So now I think is the time to show we really do value social care staff, because for too many, this value is not reflected in their pay and conditions. We have to ensure that this pandemic is the wake-up call needed to start paying care staff properly, giving them the support they need. Change and reform will need to go forward on a cross-party basis, that's clear. But I believe my party, Labour, made a good start with the pledges we made in 2019. To invest to end the social care crisis, and we've just heard in the opening session, Andrew Dilnot also agree that we do need to invest more in social care. But importantly, to end 15-minute care visits, provide care workers with paid travel time, access to training, and an option to choose regular hours. There was a slight discussion there at the start of the real living wage. We were aiming to introduce a real living wage of at least £10 per hour. And I think finally an important thing is banning 0 hours contracts and strengthening the law so that those who work regular hours for more than 12 weeks would have a right to a regular contract reflecting those hours. We can't expect care staff to keep doing more with the pay they have. They should at least be on living wages recommended rate, and that's just a start. I think it's staggering that 3 out of 4 care staff are paid less than the real living wage. Now, our summit has been asked to look at 5 questions. Should there be a growing for the future strand in any future social care people plan? What other areas of activity should be included in this strand that would promote growth in the social care sector? What should it say regarding pay, travel time and overnight payments and 0 hours contracts? And what are the main barriers to developing the growing for the future strand? How could they be overcome? And what could the next steps be for taking this forward? And I'm going to welcome our contributors and come back to them in a few moments. In our session, we should have Professor Martin Green, who's Chief Executive of Care England, Francis O'Grady, who's General Secretary of the TUC, and Charles Tallack, who is Assistant Director, Health and Social Care Sustainability Research Centre at the Health Foundation. Now, my co-chairs for this mini-summit are Lord Kerslake, former Head of the Civil Service, and Jackie O'Sullivan, co-chair of the Care and Support Alliance. And I'm going to invite them, as I said, to say a few words now. And Jackie is also going to give our session's feedback to the plenary later. So could I come first to you then, Bob Kerslake?
Well, Thank you very much, Barbara. I'll keep my comments short because I think it's really important we hear from contributors and others involved in the summit. I think the core point out of the conversation we heard earlier is that sorting out the funding is a necessary but not sufficient action. We have to do more than simply sort out the funding. And I think the key thing for me about social care is that whilst the NHS people plan is a useful starting point, the way in which we organise social care in this country is hugely different than the NHS. It's much more dispersed, much more of a balance between public and private. There is far less, if you like, consistency in the way in which it's organised and delivered. Now, that of itself is not something we can necessarily need to address. What we do need though to be clear on which things, given that variation, should be requirements, particularly in relation to the workforce. So what I feel very strongly is that, in a sense, what we need is a kind of core expectation. If you work in care, these things will apply: a real living wage, and access to training, protections against poor employers who use you inappropriately, proper standing and recognition of the needs in terms of career development. I don't think you could prescribe all of that in legislation. What I think you could prescribe and should prescribe is a statutory charter that would be refreshed and renewed over time through a collaborative process, in perhaps similar to some of the kind of wage council models we've seen in the past. So there has to be, for me, a plan definitely, but a plan that's appropriate to the way in which social care works in this country. And that's what, for me, the core mission, if you like, is to work that through so that whatever else happens, the well-being, welfare and future prospects of staff is protected. If you don't do that, there is no prospect, I think, of growing the capacity of the care sector in the future, because why would people make that choice unless there is the prospect of a strong and effective career for the future? And that's the thing I think that needs a particular sense of focus. How does this expectation work within a very different sector than we have with the NHS?
Thank you. Thank you. Jackie, I know you're going to give our feedback later too. Thank you for doing that. But would you like to say a few words now? You're muted, Jackie.
I knew that would happen. I'll be very brief as well, because as Bob said, it's really important that we hear everybody's views. But I mean, I think the point here is that, there's no question that we need to act, that COVID has exposed all those problems that we knew were there, and really now we have the spotlight. In some ways we have the interest of the eyes of the public on us, that this is the opportunity. So we need to do this quite quickly before that moves away. And as Barbara has said, it's also really highlighted the complex, really skilled workforce and the role of the support workers in all of this. They really, have been amazing, and their dedication has been incredible. As Barbara mentioned, we've had people shielding, living in with people for weeks and months to keep them safe. We've had people not seeing their own families in order to keep people safe, and going above and beyond. And where we have lost people have grieved as if they've lost members of their own families. So we owe it to that workforce to do something about this. And I'd also say that we're not starting with a blank sheet of paper. We've talked about the work of the Health and Social Care Select Committee, the finding at 3.9 billion and the work that they've done around the real living wage. But there's other areas as well. ADAS came out with a figure of £10.90 an hour based on linking it with linking pay with Band 3 NHS healthcare assistance. And they've done a lot of really good modelling around that. And a couple of years ago, the IPPR produced a report which had some really interesting suggestions around a collective pay bargaining body, and a body that might actually set professional standards, a bit like the RCN. So we're not starting with a completely blank sheet of paper here, but I think the impetus here is to do something quickly. I think linked with the health white paper that we had today, there's an opportunity to look at commissioning. And if we can move away from hourly rates and commissioning on hourly rates and hours and move towards outcomes, then that might be able to drive us towards actually having proper salaries for support workers rather than paying them by hourly rates. And I think that would make a tremendous difference in terms of professional standing, ability to pay people more, and a recognition. You know, we need to recognize people, and we need to do that in more ways than words.
Thank you, Jackie. So I'm going to move on now to open the discussion to our contributors. Could I come first to you, Frances O'Grady? Frances is the General Secretary of the TUC.
Yeah, you gave me a new job title there.
Yeah,
Thanks
new job
very
title,
much.
Chief Executive.
Thanks very much, Barbara. And I think this is such an important session. And I know it's obviously it is critically around funding and workforce paying conditions. But for me, it's also about love, duty and dignity. And I think many of us feel that through this pandemic in particular, we've all seen how social care workers have cared for us. And I feel very strongly that it's about time the rest of us as a country started caring for social care workers. You know, we've heard a lot from the government about building back better. Personally, I prefer a phrase of we need to build back fairer, but I think we should all agree that there's no better place to start than with social care. As others have said, we know what happened during the pandemic. It shone a light on some very deeply unfair practice, pay and conditions. We saw that scramble for PPE, let's not forget, right at the start, and that carried on for a good while too. We know from the TUC's research, and I should say the TUC is the umbrella body for our unions, including Unison. You heard from Christina McInerney, the brilliant new General Secretary of our biggest public service union. But we know from our research that 1 in 6 social care workers don't even qualify for sick pay in terms of, you know, what do you do in terms of self-isolation? Because we've also highlighted the difficulties of and barriers of getting any financial support when you need to self-isolate. These are workers, everybody would agree, are on the front line, and 1 in 6 don't even qualify, and a quarter are on 0 hours contracts. I mean, every single time the social care worker puts on a uniform, they are putting their health on the line and their family's health on the line. And it seems to me that all of us agree we need recognition of that. But at the moment, typically, they're doing it in order to get the minimum wage. And that feels pretty shocking. Just one other thing I'd add, because I think it is important just to say this. I was up in the Northwest a while before lockdown, meeting social care workers, and we were meeting in CAFs in department stores because their right to organise wasn't being respected either. And I do think it's really important that users of the system have a voice, that all of us have an interest, we have a voice too. But for goodness sake, I think social care workers themselves need a voice, including through their trade union. We've also talked about that this is skilled work, the importance of training and progression. I'm also kind of very interested in the scope for new technologies in this sector and how we make sure that they're technologies that assist and support social care workers and the people they're caring for, not just off a shelf to cut jobs, but actually about improving the quality of the service and supporting care workers in what can be also very physically as well as emotionally demanding work. So, you know, we ought to have training and investment for that. And of course, we've got these huge numbers of vacancies, which is another key issue for us. So from our perspective, the system does need fixing. The TUC produced a report last year precisely on this, on fixing the social care system. And we also recognise that we need to build a broad consensus, because whenever we we're looking for solutions for the long term, we know that, you know, the broader and deeper that support, the more chance it has of being sustainable and winning it in the first place. We do think that everybody's got a contribution to make, and that's why this coalition is so important, because we do need diverse voices around the table to create that consensus. But there's no getting away from it. We need a new funding settlement. We cannot do this on the cheap. We cannot, let's say what it is, we cannot exploit people in order to produce the service that we want to deliver. And we would argue that we have to recognise that privatisation and fragmentation of the system has left it incredibly fragile. And we know the human consequences of what happens if particular establishments end up going bust. So we think we've got big challenges ahead. I do want to just mention migration policy, immigration policy, settled status. You know, so many of the workforce are migrant workers who've shown such dedication. And it seems to me that many are not being treated with the respect and the reciprocal security that we should be offering. We've got big challenges, I think, on the technology front and with an ageing population too. But I guess my final point, Barbara, is, you know, recovery is no recovery at all if it's not a recovery for the millions of key workers who have shown such dedication, and in particular for social care workers. So I think we should repay that dedication in cash, but also respect. And I think we should look to build that nationwide system, properly funded, in our view, through general taxation, properly funded, to create the kind of system that, just like our NHS, we can be proud of. Thank you.
Thank you very much, Frances. I'd like to come next to Martin Green. Martin is the Chief Executive of Care England. Thinking back to that time that Frances was just referring to, when there was a fight for PPE and all the issues, representing all the issues that the care sector had in that awful time. I know you were really in the thick of it, Martin, so it's been a heck of a year for you. So could I come to you next for your contribution?
Yeah, thank you, Barbara. And I want to say I agree with all the previous participants. This is a moment when we have seen the skills and competencies and sheer commitment and love, as Frances says, of the care workforce. And what we've got to do is we've got to use that as a platform to completely redefine care and to look at how we develop a future strategy that will make it a career of choice. And I use that term, a career, very advisedly. And I think one of the problems that we've had as we've been debating this in the past is that we've often talked about the money, but we've talked about it from the basis of where we are. Well, where we are is nowhere near where we need to be. So what I would like to do is to start thinking about a vision for the social care workforce, and then thinking about going to government with what this is going to cost. I'm also very conscious that one of our challenges is that we are always at the side of the NHS, which is dominant in terms of both the recognition and also the resources that are available. And one of the things that really became apparent in the pandemic was that the people in social care were supporting people with equally as complex needs as those in healthcare. And I do think we should recognise that these are two interdependent systems. And I'd like to start crafting a workforce strategy that would enable people to move seamlessly across those systems, just as citizens do. I think that's the way we will be able to deal with the challenge of needing more people. I also think there is a really important element here to recognise. When you look at care workers, often they're doing their job and they have little or no support. So they are in effect very autonomous in their decision making, and they co-produce their decision making with the people they support. Going to something which Clinton Farquharson said earlier, we have got to have people who use services absolutely at the centre of this debate. Now, I also think, there's a lot of talk about the living wage and all those sorts of discussions. frankly, I want social care workers to be way above the living wage.
Yeah.
I think the complexity of what they do, the commitment they show, the outcomes they deliver are really, really much more than being a job. This is a career, and we need to start recognizing and remunerating in that way. I think we've also got to get some really clear skills and competency frameworks that are portable. Francis mentioned the challenge of a very diverse sector. Well, if we had some clarity about the steps on a career pathway and the skills and competency frameworks, if we had a really clear approach to qualifications that meant they were portable, then what we would see is people would be able to navigate that diverse group of providers, but they would still be on a career path. I'm also very interested as well around the development of things like the apprenticeships and trying to incorporate a whole raft of different entry points into social care. I also absolutely believe that this should be a profession and it should be remunerated in that way. But I also want to make sure that we don't lose the opportunity, particularly to bring people into the workforce who might not be able to give a full-time commitment because of other responsibilities such as caring responsibilities or indeed education, but who will make a tremendous a contribution. So in making sure that we have a professional approach, let's not lose the flexibility which enables people to come into this workforce and to do something which is very, very powerful and helpful to the people they support. And I also think we need to look at the issues around diversity and enabling people from different environments and different pasts to be able to come into social care. Now, I think what was very obvious to me was that there's going to be a big shakedown in hospitality and retail. And I think we should think about how we encourage some of those people to come into the workforce. And then that brings me on to the issue for me, which is about how we deliver a workforce strategy that is based on the values of social care. And what we've got to do is we've got to just recruit people on values and then train them on competencies and skills so that they are able to be supported to deliver this complex work. The final thing I want to say as well is that I think we're not very good in social care at understanding the well-being needs of our colleagues. And there is not enough time for reflection. There's not enough time for people to take time out to sort of absorb some of the really complex work that they've done. And, you know, you said it yourself, Barbara, it's emotionally and physically draining. And we need to make sure that people have the space to manage that. And I think also that there's some of the ways in which well-being is supported in the NHS. I see no reason why that can't be rolled across the system to social care as well. And there needs to be many more opportunities for health and social care staff to come together, because that will aid understanding of their different roles, but it will also aid better communications and integration across the system. So in short, there is an enormous amount to do, but I think this is a moment in time, and I think we've got to grasp it and we've got to really push this agenda, because tough as it is, we have seen what social care did in this pandemic, and we must use that as our platform not to move forward and not allow people to just slip back to the status quo we're in at the moment, because what we have at the moment is not fit for purpose. Thanks.
Thank you very much. Thank you very much, Martin. Well, and I should say people are putting points in the chat. We've had a couple of points as Martin was talking there. One about 0 hours contracts, and somebody else. The point I think Martin touched on, that we may be aiming too low if we're talking about the real living wage. I think you covered that point, Martin. But can I come to Charles Tallack as our third contributor? So over to you, Charles.
Thank you very much, Barbara. So the Health Foundation have been arguing for some time that increasing the pay and improving the conditions of social care workers is critical. And what we've been trying to do is trying to make the case so that government acts. And most recently that we did that in our submission to the Select Committee. I think it's, before I start talking about the workforce size, I think I feel it's very important to see the issues of workforce reform and improving pay and conditions as part of a much bigger picture of social care reform. I think there's a real danger in seeing these issues as unconnected, and in just kind of trying to fix some of the symptoms we see. And I think, there are issues, of course, with the overall funding of social care and the access that people get to care. And of course, there's the ever-present issue of how people pay for social care. Obviously, we've got a system, the system currently, and the people working in social care are both working for private payers, but they're also working for to care for people who are publicly supported. I think in terms of the case, there's a moral and human decency dimension to it, that staff working in social care, as Francis and Martin have said, they do some of the most important jobs in society, and yet they are some of the lowest paid and face some of the most difficult conditions. We know, obviously, through the pandemic that people working in social care were much more likely to die than people working in health care or people generally in the working age population. There's also, of course, a dimension which is about quality of social care. So low wages and poor conditions contribute to poor quality care, mainly, I think, through high staff turnover. There's not actually very good evidence on this, but I think it's certainly the kind of high staff turnover one is a way in which that contributes to kind of poorer quality care. So I'm just going to talk you through, I think, because I think it is worth just reminding ourselves of some of the facts. We've spent quite a lot of time trying to get together a bit of a picture as part of our basically trying to provide evidence that DHSC and the Treasury will kind of listen to. So this is part of our ongoing work. So some of these things you may already know, but I've tried to pull it together into a kind of a set of things. So there is a high vacancy rate in social care. So that currently it's about 8%. That's higher than lots of other sectors, service sectors. There is also a high turnover rate. So the number of people leaving their jobs in any 1 year is about 30%. That compares, actually, it's lower than hospitality. So hospitality is about 40%. That's hospitality and catering. In manufacturing, it's less than that. It's about 27%. Most of those people are leaving for other jobs in social care. The number of people in a year who leave social care altogether is about 10%. And most workers who leave the sector altogether are leaving for roles in healthcare. So, for example, in 2017, 3% of those leaving left their jobs for jobs in retail, so only 3%, whereas 14% left their jobs for roles in healthcare. People have talked about 0 hours contracts. They're 24% of all social care jobs, and they're most common in direct care roles. The London labour market, or the kind of social care workforce, is very, very different. Like when you compare regionally, London sticks out. It's a complete outlier. So it's astonishing, but 0 hours contracts in London account for 50% of all contracts. Just on pay, hourly pay for direct care roles is very close to the national living wage. So it's £8.90. That's direct care workers, people who work in direct care roles, versus £8.20 national living wage. And this is something I found pretty shocking, that pay in the independent sector has barely increased for most job roles. So the average pay, nominal pay, so this is not inflation adjusted, nominal pay went up by 7% between 2012 and 2019. That's 1% per annum. And for nurses working in social care, it increased by 26%. That's quite an astonishing difference. Why would we value, basically social care workers over that time have their rate of pay has reduced relative to the cost of living? And it's only regulated professional roles that have seen a significant pay rise since 2012. Progression is very limited. There's obviously a very flat hierarchy. So the ratio of senior care workers to not senior care workers in home care declined from 7% in 2008 to 4% a decade later. And obviously, as well as all those things like poor pay, poor progression, there are a number of other factors which can lead to stress in the workforce and dissatisfaction. In surveys, care workers felt that wider society didn't regard supporting the old and disabled and people they care for as a career. That's not generally viewed as a career. Obviously, there's a lot of stress in the role. So there's the kind of stresses were talked about as being role ambiguity, role conflicts. The work itself is very demanding. There's heavy workloads and often unsupportive organizational cultures, and they're all contribute to stress and burnout. But I want to end on the positive, which is I think there are aspects that we could build on. 50% of employees in both long-term and non-medical healthcare stated being satisfied, completely satisfied or very satisfied. In the retail trade and hospitality, the share is actually a bit lower than that. It's about 40%. And the satisfaction was gained from the work itself and people feeling they had the opportunity to use initiative. So, I mean, there are clearly, but it's an incredibly important job. That is where people get, I think, the satisfaction from, but clearly there are a lot of things that make this a very stressful job, and we're not rewarding these people, the people who work in the sector, properly.
Okay, thank you, Charles. That's really useful. Let me throw it open now to questions. I'm going to take questions in groups of 3 if I can manage that. People have been putting comments in, and that's very helpful. Can I go first to Louise Platt? Louise.
Hi, yeah, I just wanted to comment back on Martin's talk about the professionalisation of the sector, and I see other people are commenting on our image problem. I think I haven't particularly got a question, to be honest, because I just really feel quite passionately about the viewpoints that are being put forward this afternoon. One observation I might proffer is that for an organisation that is regularly bidding for local authority contracts, what I find very difficult to sustain as an employer who wants to pay higher, unfortunately, we're held to putting in a price, and that price is not probed into how much of that price goes towards the pay and benefits to our staff. And therefore we get prejudiced, really. I feel it's not an even playing field, because there might be less scrupulous employers that get in there before us because they don't pass on the benefits of that price to their employees. And I think that might be something to bear in mind as a stepping stone towards, obviously, more funding. But that might be something we could look at now.
Yeah, thank you. And could I come next to John Sutcliffe? Is John there?
Sorry, just trying to unmute myself and try and start the video. Hi, hello, yes. Yeah, my comment was about the bit of a departure for the Local Government Association, which I work for, in a way that we've recently decided to adopt the policy of calling on government to carry out an independent review of social care pay and reward, with the view to, I suppose, doing 2 things. One is carrying out a proper formal comparability exercise with comparable NHS jobs and other relevant sectors, and also to do something about thinking through what kind of pay setting mechanism could be set up in the future. Bob Kerslake, who I see has now left the group, talked about wages council systems, for example. I suppose instinctively in the LGA we favour kind of collective bargaining mechanisms rather than pay review body style mechanisms. But the key point, apart of course from making sure that this is properly and sustainably funded, which has been a dominant theme throughout this afternoon's event, it's also really important that anything that is done with the I don't know whether consent is the right word, but with the informed understanding and agreement of the very, very diverse and large number of provider employers in the sector, which of course, as people have commented, makes it very different from the rather more monolithic NHS. So I don't know whether panelists could perhaps comment on how they see that a way forward to developing that consensus and working with providers. I mean, Louise has commented very aptly on the kind of hourly rates issue. Obviously, if money were no object, I suppose we'd all be in an ideal world, but we need to have process and mechanism and stuff to take all this forward properly. So perhaps people would like to comment on that.
Thank you. Thanks, John, and thanks, Louise. Could I come to the panel then? Could I come to you first, Francis?
Yeah, just to say, Martin, I don't know if you remember this, but when I was on the Low Pay Commission, I have to say you're an incredibly able champion for the sector. And I don't think it's compromising any confidentiality to say that you were so clear that you wanted to see workers in the sector paid better. You know, that in terms of employers, you were struggling with recruitment and retention and progression because there just wasn't enough money in the system. And so I think kind of when Louise talks about the image problem and the sheer frustration of that, when so much of it seems to be that central government points the finger at local government points the finger back at central government, and everybody else is jamming the sandwich. And until there's a bit more kind of honesty, including some of those comparability studies that John has suggested, hard evidence, this is where we want to get. We've got a broad coalition. We all know there's a problem. We know that there's, frankly, has been for a long, long time a shortage of basic funding in the system, then we're not going to sort it. But I do think how you sort it matters too. And the TUC for some time has been saying that we've got the national minimum wage, okay, and we have the Low Pay Commission that recommends to government on that. But there ought to be real scope in areas like social care, where, let's be honest, a hell of a lot of it depends on central government funding. There ought to be scope for employers, unions, and government to sit down together and figure out what the workforce package should look like, because you see it not just in this sector, in many other sectors where the price is set. It's totally unrealistic, particularly for small family enterprises. And the only way you could meet that price is, frankly, by exploiting the workforce, and yet nobody's taking responsibility for those decisions. Everybody's pointing fingers at everybody else. So I'm attracted by the idea, and it's obviously TUC policy, but that idea that we should get around the table, let's look at pay, but let's also look at standards in training, in progression. Let's look at the future, how we're going to plan for the future to make sure that this is a brilliant service for the people who deserve a brilliant service, but also for those who deliver it. Because, I know it's a cliche, but you cannot deliver a world-class service if you treat your workers third class. It's as simple as that. So, I think there's lots of scope. Clearly, there's lots of scope for discussion about how we do it, but we do need that funding commitment from government to make it even possible.
Thank you, Francis. I'll come to you, Martin, but Simon Bottery has put up some points and he says he has to go, so I'm just going to touch on the points he made. He thinks the first priority is to enforce current legislation. Estimates of non-payment of minimum wages around 11%, and that's a good point, I think, and there's a private member's bill on this. But critical to find a realistic route to pay workers more, because the sector is very diverse, many employers. So he suggests possibly a sector-specific living wage, requiring better pay in local authority commissioning. Of course, many councils are now signed up to the ethical care charter. My own local authority of Salford has got its own local standards, and we've been paying. We had an offer to care staff during the pandemic to make sure that they are paid to isolate and that they don't get into that problem. And he makes the point that I think everybody wants to make today, that better pay has to be part of wider reform and better funding, because in itself it's also not going to help the problem of meeting unmet need, and you know those things have to go side by side. Martin, do you want to come back on those points?
Yes, Francis, I remember those commission meetings very well. But I think also I'm quite attracted to the idea that Tom suggested about having some kind of independent sort of overview of this. And I think Francis is absolutely right. What we've got to do is get together as employers, as unions, and start thinking about, first of all, our new vision for social care. What is it about? And we also need to take away the notion that you commission this by the minute, and you should be thinking about commissioning for outcomes. And you know, Louise made that very important point about how sometimes in this race to the bottom, and I'm not criticizing local authorities here, I think the problem is there is so much you know that you have to do, and there's so little money to do it. But what happens is, you know, people like Louise, who've made this real commitment to quality and commitment to supporting her workforce, loses out because the baseline of discussion is all about price, not about quality, not about outcomes, and not about how we nurture and professionalize our workforce. So I really think there is some traction in what John's trying to do, and I guess we all should pile in behind him to support that.
Okay, thank you. Can I bring in as the third question that we've had a few points made by David Lewis? Yes.
Sorry, that's me. I haven't got access to my own IT, so I know. So I'm borrowing somebody's to join today. So
okay,
my point is,
you are David Lewis.
So I'm Caris Phillips.
Yeah,
I'm the chair of the Social Workers Union. And my point is that we've got two legislative arms, which is the NHS and the Care Act, Social Services and Wellbeing Act in Wales, that need to be fixed in order that care is free at the point of delivery. The Scottish are doing a review of their legislation, and that's the basic point, really. So if you're starting from a baseline of legislative changes, then you can move forward without the marketisation that has been so disastrous to older people across, you know, all of the UK. And I'm thinking about the Jasmine report in Wales and in Dr. Daz and the abuse that happens because of poor care. And then a code of practice that's legally enforceable for employers. So Louise and you know, the good employers that are doing their utmost, their best, and some fantastic work can flourish, really. So that was it, really. Thank you.
Thank you. Could I come to you, Charles, on any of those questions that we've just had answered?
I mean, on the first question, actually, and I would actually agree a lot with what Simon said. I would make very similar points. I think one of the things that people often talk about is about the local authority commissioning, and I can see that is one route towards which we could improve the pay and conditions of workforce. I absolutely see that, but this is at the moment a mixed system. You know, we have private payers and we have publicly funded people, and of course our interest should extend beyond the people that the workers that we pay for, the state pays for, and the users that are funded. You know, this is a social care system which needs to work for everyone. So I think any solution really needs to recognise that there is also a private market out there, and lots of these things about local authority contracts. You know, the private payers are also, you know, the kind of, it's not like the workforce that they employ have got brilliant terms and conditions. They're the same workforce basically. So that, I think, in my mind, makes me think, look, we need a much wider solution. Of course, there are lots of things which you can do, but we actually need to make sure that these things address all social care users and people in the workforce. And, you know, obviously there are things like sectoral wages. You know, there might be things like CQC actually in terms of their inspection regime, looking at the pay and conditions of workers. I'm just, you know, I don't have the solutions, but we obviously need to think pretty broadly here, and as I said, consider the whole of the system, like both for users and the workforce.
Thank you. Thanks very much. So I can invite more questions now. Going back to our 5 questions, I think one or two of the areas are about growing the workforce. So I don't know if anybody has any points on that. I mean, clearly it's going to be difficult unless we can get past this, you know, respect, dignity, proper pay and conditions, and onto a proper career path. But, you know, what's also very, very important is that we do something about the 112,000 vacancies, and particularly the vacancies for registered care home managers. We've been in a weird situation of, you know, on top of that, a terrible vacancy position, having staff self-isolate or being sick. So it's been a heck of a year, really. Any points or questions on those? If I can throw it open.
Barbara, I would just also like to make a point that one of the other things that we need to do is we need to have a root and branch reform of how we regulate social care. And one of the things that I find really difficult, and particularly I think it's reflected in the registered managers' roles, is that often when there are mistakes, people are then singled out, and it becomes much more about identifying the individual being at fault. Now, I think we should move to the system that the airline industry has, which is about a critical analysis of the incident and trying to learn lessons from it that are then cascaded across the entire sector. Recently, I saw a pilot saying that he'd made a slight mistake on the entry into Heathrow. First thing he did was shut down the aeroplane, talk to his colleagues on the flight deck, and then inform the regulator. And I thought to myself, if I was a social care worker and I'd made a slight error, I'm not sure my first port of call would be the regulator, because I wouldn't have confidence that they wouldn't try and assign it all to my fault, rather than a systemic analysis of whether or not there are other issues. So I do think one of our challenges is to use the system that we have to be much more about sector improvement, rather than just identifying endless problems which are just replicated rather than challenged and then improved.
Thank you.
Yeah.
Thanks, Martin. Yeah. Peter Luce, you were indicating. Do you have a question?
Thank you. Yes, I'd like to make 2 points about seeking to abolish 0 hours contracts. One of the strengths of the social care workforce is the diversity of its employees. I completely agree that 0 hours contracts are not a fair way of employing people who depend on predictable income, and certainly not for 24% of the workforce. But for a minority of care staff, 0 hours contracts are a desirable form of employment, and they can also benefit the care provider and person using the service. Some of these people don't want the obligations of regular employment. I would give semi-retired people in rural communities as an example, who are often ideal relief staff in their own communities. So at a time when we have a staffing capacity crisis, we shouldn't exclude any suitable person. And I would suggest that rather than banning 0 hours contracts, I would argue for a right to a proper contract, not an obligation. And then on the same subject, I would argue that the basis of contracts between local authorities and care providers is very similar to 0 hours contracts. And in order to underpin a ban on 0 hours contracts or a right to a proper contract, providers need a similar right to security of the income to fund that pay. Thank you.
Thank you. Francis, any thoughts on that, on 0 hours contract?
Well, I think Peter makes some really interesting points. I guess one of my problems is that I always think 0 hours contracts are misnamed, because we know that the typical 0 hours contract worker is in fact working well over 20 hours a week, which makes you question why they've been put on a 0 hours contract in the first place. And of course, very often it's because they miss out on a whole raft of what you and I would consider were absolutely basic human rights for any worker. So there's a problem there. I think In fact, what the TUC is calling for is the right to guaranteed hours, because we know that many employers and many workers want flexibility, and we believe that flexibility needs to be a two-way street. You know, it is possible to have positive flexibility without surrendering all your basic rights to be accompanied by a union rep or sick pay or anything else. You know, it ought to be possible to have positive flexibility. But we're also, you know, a huge issue that comes through all our work in terms of talking to workers, listening to workers, but also opinion polling, is predictability of shifts and hours. It's so hard to plan family finances, and it's so hard to plan your own caring responsibilities if you're hanging around on the end of a phone, or very often called into work and then sent home again with no compensation. So, you know, I do think we have to unpack, you know, obviously our rallying cry, ban 0 hours. Behind that is a positive call for guaranteed hours and the rights that we think that every worker in Britain should have. So, you know, that's maybe an area, again, where we could find more common cause.
Thank you. So, any further questions for the panel? I think at the moment. Charles, do you want to comment on that, on the last point about 0 hours contracts versus guaranteed hours?
Not particularly, Barbara, as in I think Peter makes some good points. I think Francis is far more of an expert in this than me. You know, I can absolutely see that we do not want, where that suits workers, that we wouldn't want to be like turning away employment opportunities. But yeah, I don't particularly. I kind of know what outcomes I'd like. You know, I'd like a you know, a workforce which is gets derived satisfaction from their work, they have progression and security. But I'm not an expert on, you know, the particular contractual form which will deliver that.
Okay. Thank you. Well, Tom Hemmings has put a comment in the chat. For young people, the care sector is the second largest sector for young people. Will there be an end of age-related pay for young people entering the sectors and able to start on the same level as fellow staff? Did you want to add to that? Is Tom Hemmings there? Tom Hemmings?
Hello. Yeah, sorry, thanks for asking that question. Yeah, just really interesting about the aspect for young people, because it is the second largest sector for young people, and it's considering that it's a turning point for where people may want to get into the sector. When young people do enter that, the moment they start getting into that sector, they get discriminated straight away, even by age and also by potentially other practices. And so I wonder what's the aspect as young people being taken into consideration for the attraction towards future contractors. Thank you.
Okay, so some comments on that. End of age-related pay for young people entering the sector. Could they start on the same level as fellow staff? Francis, could I come to you first?
Well, this is something, you know, I'm really proud that unions put a big priority on, is actually making sure that people are paid for the job they do rather than how old they are. So, I mean, just to say, we've always accepted, when it comes to apprenticeships, we've always accepted that there's a sort of contract, if you like, that when you go into an apprenticeship, you may be on lower pay, you're learning, as long as you're getting quality learning and training and skills, including off-site, that's grand. And then if you do well in your apprenticeship, you go into the pay grading system on the same way as everybody else, and hopefully get a permanent secure job out of it. So we've always accepted, if you like, that traditional contract in respect of apprenticeships. But I mean, frankly, we find it hard to understand why two people doing the same job, performing as well as each other, should be paid differently just because of a fairly arbitrary age in respect of the statutory national minimum wage, as we still call it, living wage as the government calls it. You know, young people may have kids too. Young people may have, you don't get a discount at the supermarket because of your age or from the utility bills. So there's a sort of fundamental principle for us that, if you put in a fair day's work, you should get a fair day's pay.
Fine, thank you. Thanks, Francis. Well, we're into the last 5 minutes now, so I'm going to go back to the panel and to Jackie and just ask them for their final thoughts on the questions we were set, really, on getting this social care people plan. I think we've talked in some depth about what might be in it, and also pushing for funding and a fair deal. So can I come to you, Martin, on that?
Thanks, Barbara. And I think one of the things that's really powerful about today's session is the amount of agreement there is. And I think one of the ways we do this is for us all, as employers, as unions, as people who represent service users, we all come together and we start to be really clear about our asks. But we don't just take no, we push this agenda from our different perspectives, but also in a way that coordinates and unifies the message. And I think it's been really great to hear that there is this consensus, and we've got quite a diverse group of people on this session, and yet we've got a really good view about how to move forward. So I think what we should do is just coalesce around that and perhaps get our ducks in a line so that we're all saying a pretty similar thing. And it goes back to crafting a vision for social care and then working around that. And saying, well, what would that vision look like, and how do we need to develop our workforce in order to be fit for purpose for that vision? So let's start with the vision rather than the money, and then let's work to say, how much is this going to cost? Okay, thank you. Breakout rooms are going to close. Charles, any sort of final thoughts?
I agree with Martin, but of course the money is important as well. Nothing's going to happen until Treasury is persuaded to pay more, because we will not get higher wages